Hello and welcome to the HCS 542 Masters in Health Administration Competency-Based Competency 2 Assessment Part 1 Visual Narrated PowerPoint Presentation entitled Meaningful Collaboration Video. This presentation will be both a visual as well as audio recorded presentation in which I will outline the necessary requirements needed in the development and implementation of meaningful collaboration within healthcare leadership. Within this visual and audio presentation, I will also further discuss the types of strategies utilized in increasing collaborative efforts within healthcare leadership and workforce members. This PowerPoint presentation will further discuss how ineffective collaboration efforts within an organization's leadership can also negatively impact a healthcare organization. Effective leadership is a vital component within the collaborative efforts of a healthcare organization. Within this same vein of thought, effective collaboration is central to the functions and daily operations of the healthcare organization's many processes and interdepartmental operations. Effective leadership and collaboration amongst an organization's leadership and its workforce requires that workforce members and healthcare leaders assume a complementary role in working alongside with others in order to accomplish the organization's goals and initiatives. According to the National Center for Biotechnology Information, collaboration in healthcare is defined as healthcare professionals assuming complementary roles and cooperatively working together, sharing responsibility for problem solving and making decisions to formulate and carry out plans for patient care. Effective collaboration between an organization's leadership and its workforce is essential in fostering organizational communication and growth, and can lead to an increase in organizational trust, honesty, respect, organizational workflow efficiency, quality control, and increased healthcare processes. According to Fairbank, effective collaboration is important for any organization, but it is particularly important in healthcare. Collaboration done well in a hospital setting means better patient experiences, fewer errors, increased efficiencies, and the list goes on. Healthcare leaders, through their efforts to build lasting collaborative efforts with their colleagues, improve organizational processes by encouraging workforce members to approach them when in need, provide feedback and/or suggestions, and partake in the planning and care process within the healthcare organization. There are several barriers that exist within the application of collaborative leadership strategy within the healthcare organization. These include barriers such as cultural differences, differences in communication styles, leadership styles, individual employee and/or management values and beliefs, hierarchies within the organizations such as gender roles, age, and conflicts within these roles, as well as expectations which each individual has upon each individual's values, beliefs, and/or cultural practice. Effectively mitigating these barriers requires that the organization's leadership is receptive to its workforce employees and that they handle each complaint or issue with professionalism, equity, as well as understanding. Just as surely as effective collaboration and leadership efforts within an organization can foster growth, build trust, and strengthen organizational collaboration efforts, ineffective collaboration within an organization can do just the opposite. Ineffective or uncaring leadership can directly impact organizational cohesion and community efforts. Additionally, ineffective collaboration efforts and/or leadership can lead to an increase in medical errors, poor communication, and mixed messages amongst the organization's leadership and workforce, and the organization's ability to adequately relay instruction as well as directions, delineate tasks and/or duties, and effectively manage other workforce members under their direct and/or indirect supervision and/or oversight. In order to foster effective leadership strategies which increase organizational collaboration and cohesion, healthcare leaders must ensure that collaborative efforts within the organization are central to the organization's efforts and care initiatives. Instilling the values of teamwork and collaboration is key in developing effective communication between the organization's workforce. Additionally, an organization's leadership in its efforts to improve organizational cohesion within its collaborative efforts and initiatives needs to set aside time in order to increase cohesion efforts amongst the organization's various departments. Further, healthcare leaders must set the example that they want their workforce members to exhibit. Healthcare members or leaders must exemplify the qualities of professionalism, discernment, a willingness to listen to the views and feelings of their members, compassion, integrity, as well as self-awareness. Lastly, healthcare leaders should ensure that they are encouraging open communication amongst their workforce members and/or collaborative teams, and consistently invite employee feedback and team building. Further, healthcare leaders must maintain their individual self-awareness. Self-aware leaders are leaders who are willing to self-examine their own feelings, emotions, biases, and/or beliefs and root out negative impulses and behaviors that may negatively impact organizational collaboration. Effective leaders further foster timely and consistent organizational strategies that assist in the development of team cohesion as well as collaboration initiatives. Effective health leaders foster effective leadership strategies that increase organizational communication by utilizing effective techniques that are clear and outline organizational goals as well as expectations. Further, healthcare leaders clearly delineate roles and responsibilities of each member within the organization so that each member knows what is required of them. Further, healthcare leaders are able to offer constructive criticism when necessary in order to improve employee performance, provide praise, and/or instill disciplinary action. One example that I came up with for team cohesion and organization within the organization is to come up with a strategy in which team members are able to effectively sit with each other and be divided into groups and work with each other in a cohesive manner. The example that I came up with requires that employees are in attendance in a company in-service meeting. Once employees are gathered together, the team's leader or the healthcare leader will then separate the groups into 5 equal groups, and if possible, 6, and then provide the groups with the name of the exercise entitled Stranded. Within this exercise, each team member will receive the scenario of being stranded on an island with only several items. These items include an axe, a flare, a shovel, a flag, a cell phone without batteries, and a hunting knife. Of the provided items, each team member must choose only 3 items and then must collaboratively work together in order to explain how each of their chosen items will be useful in their escaping the island. Each team will then have to explain why they made each choice for their chosen items. This exercise is excellent, or it serves as an excellent way in order to, number one, break the ice between employees who may not speak to each other or who may be from different departments, as well as to interact and collaborate with each other. As highlighted within this exercise, effective leadership and teamwork is a vital component within the collaborative efforts of a healthcare organization. Within this same vein of thought, effective collaboration is central to the functions and daily operations of the healthcare organization's many processes, as well as interdepartmental operations. Effective leadership and collaboration amongst an organization's leadership and its workforce requires that workforce members and healthcare leaders assume a complementary role in working alongside each other in order to accomplish the organization's goals and initiatives. According to the National Center for Biotechnology Information, collaboration in healthcare is defined as healthcare professionals assuming complementary roles and cooperatively working together, sharing responsibility for problem solving and making decisions to formulate and carry out plans for patient care. I would like to thank you for accompanying me on this video interview within this PowerPoint presentation, and I will further provide material as well as practices on how to increase organizational collaboration amongst healthcare leaders. Thank you.